Today, I will be presenting a case study on a patient with a mysterious respiratory illness. Although this may not seem like an actual science experiment, it has the same structure. I had to ask the scientific question: what is the patient suffering from? I answered this with a hypothesis, guessing a few of the possible diseases. Then I conducted my experiment. Now, I can't run an experiment on the patient. Rather, I run various tests to conclude whether my hypothesis was correct or not, such as a COVID-19 test. Finally, I analyzed those results and summarized what the disease actually is and how it infects the human body. I hope you learned something new from my video. Meet the patient, Callie. She's a 26-year-old female who lives a healthy lifestyle. The patient has a baking business in San Francisco, and things were going very well for her. Her business was booming, and her wedding was drawing near, but it was all quite stressful for her. Between running her fast-growing business and planning for her wedding, the patient hadn't been able to get her usual 8 hours of sleep at night. Although she had always lived a healthy lifestyle, exercising daily, and eating healthy, she just hadn't been feeling herself lately. She was tired all the time, ran a consistent low-grade fever, and had lost weight as her appetite decreased. She had difficulty breathing, and she coughed up sputum. None of these symptoms alone had been particularly alarming, so she put off seeing her physician for a few weeks. Over this time period, her symptoms progressed. Day by day, her symptoms got worse. After standing for long periods of time, she could barely breathe. In fact, she couldn't work a full day in the bakery without feeling like she would pass out. Eventually, when it got to the point of extreme exhaustion and high fever, the patient could not get out of bed, and it was then she sought medical attention. Many of her symptoms seemed to match those of COVID-19, and since that is quite common these days, I suspected it could be another case of this infectious disease. I asked the patient if she had met anyone out of country in the past 3 months. She did mention her employee, who frequently visits her family in South Africa. Her employee also had a consistent cough. That's when I started to suspect tuberculosis. But to be sure, I needed to run some tests. South Africa has a high incidence of TB, and since the employee who was showing symptoms was frequently visiting South Africa, it may be possible that her employee had TB and passed it on to the patient. This was another step closer to confirming the diagnosis. Since the patient said that she had been very stressed and hadn't been getting her normal amount of sleep, she was susceptible to infection. Her immune system was weakened due to stress and fatigue. So, if she had worked with her colleague who was infected with TB, the patient may have been able to fight the bacteria and contain it for some time. But when she got busy and stressed, her immune system became vulnerable to a TB infection. Therefore, she may have active TB as a result of a weakened immune system. Otherwise, her body could have either fought it off or contained it to latent TB. At this point, it was necessary to order tests and sputum samples in order to make a diagnosis and identify the underlying cause. The result was positive. Her chest x-ray revealed nodular formations in both her lungs, near the clavicles. Since these nodular formations are in the upper lobes, it's likely that the patient has active TB. I had the patient test for COVID-19, but the result came out negative. I also had the patient undergo a tuberculin skin test, and since the size of induration was more than 15 millimeters, the result was positive. If this was latent TB, the patient's symptoms would be less severe and more flu-like, and her chest x-ray would reveal a granuloma, not a widespread infection, in the lungs. Therefore, the patient has pulmonary tuberculosis. For informative purposes, I'll provide details on this infectious disease. Tuberculosis is a respiratory illness caused by Mycobacterium tuberculosis. It's airborne and affects gas exchange in the infected patient. The patient can either have latent or active TB. Latent TB is not contagious, where patients experience little to no symptoms. However, latent TB can progress to active TB, and here's how that works. When a patient is first infected with M. tuberculosis, normally the macrophages in the lungs can fight it off. It will engulf the bacteria, surrounding them in a phagosome. The lysosome in the macrophage merges with the phagosome and releases enzymes to break down the bacteria. But TB can produce a protein that prevents the lysosome from merging with the phagosome. This allows the bacteria to multiply and create a local infection. From here, the infection can spread, but in cases of latent TB, the macrophage and infected area will form a granuloma, which will contain the infection to that region. This is latent TB. But if this granuloma breaks open, then TB can spread throughout the lungs to cause a widespread infection, resulting in active TB. That's how latent TB progresses to active TB, but it can take years before latent TB becomes active. In active TB, inflammation and scar tissue in the lungs are present due to the immune response. Active TB is contagious, and the patient will experience symptoms. Active TB infection usually takes place in the upper lobes of the lungs, since TB bacteria prefer to reside in areas with high oxygenation. TB can result in pulmonary fibrosis, where lung tissue thickens. The alveolar walls are made up of thin, spongy tissue, and when this hardens and thickens, it makes it difficult to breathe. If we recall Fick's law of diffusion, we know that there's more surface area and thin walls in alveolar cells. The diffusion of particles will be more efficient and quick. We know that if there's more surface area and walls are thin, then the diffusion of particles will be more efficient and quick. So Fick's law of diffusion states that the rate of particles moving is equal to delta P times the surface area times the diffusion constant, all divided by thickness. Alveoli have a lot of surface area, and they have thin walls. So if the alveolar walls increase in the thickness due to pulmonary fibrosis, then oxygen transfer becomes difficult, resulting in the patient having difficulty breathing. So that's how tuberculosis affects gas exchange. The patient's treatment consists of 4 different antibiotics. The patient will be on a 6 to 9 month treatment plan consisting of the following 4 antibiotics: isoniazid, rifampin, pyrazinamide, and ethambutol.